Meanwhile, people extremely vulnerable to COVID-19 could soon have more ways to access a vaccine. The state is now expanding who can provide them in an emergency order. But there are still questions about how someone who's vulnerable qualifies and how they can sign up. ABC Action News reporter Haley Bull is pushing our state leaders for answers tonight.
Darlos Walinga is eager to get a COVID-19 vaccine. She says COPD and a genetic condition make her high risk. That's why this emergency order is a huge relief to the dance instructor.
I was very excited because that means people like me, other people that I know that have other conditions that make them vulnerable, we're going to be able to get them just as soon as we can figure out how to log in and sign up for them.
The order allows educators, firefighters, and police over 50 to now access the vaccine. It also addresses people who are extremely vulnerable to COVID-19. Hospitals can already vaccinate people they determine to fit. Now physicians, advanced practice registered nurses, and pharmacists can too. A physician must determine someone is extremely vulnerable. The order says that should include a statement that a patient meets defined criteria established by a form from the Department of Health. We've reached out to the state for more clarity on this and the process for signing up, receiving no response at last check.
The instructions for physicians and other providers of health care have to be clear and unequivocal.
USF's Jay Wolfson.
The executive order appears to say that the Walmart pharmacies, Publix pharmacies, CVS pharmacies and others will be the sites for those individuals.
We checked in with pharmacies. CVS says they'll develop a process ensuring patients have access in line with the executive order. Publix tells us eligible individuals include those extremely vulnerable as determined by a physician, while Walmart tells us they're updating their internal processes and scheduling system to reflect the new eligibility. But Wolfson says the biggest challenge still may be supply.
I think the next couple of months we're going to see more available product, and then we just have to get the wheels of this system working.
A system to vaccinate that people like Walinga are ready to access.
I'm going to log on tomorrow morning and see what happens.
In Tampa, Haley Bull, ABC Action News.